Truly successful decision making relies on a balance between deliberate and instinctive thinking. That's Malcolm Gladwell in his book Blink. And it's not just a catchy quote, it's a clinical truth. Neither pure logic nor pure gut feelings wins alone. The best decisions, they are a cocktail, equal parts analysis and instinct. Take MS Dhoni. His captaincy was a masterclass in blending strategy with audacity. Now, what does this have to do with medicine? Everything. Scientific knowledge is essential, but wisdom in medicine, that comes from empathy, context, and knowing when to pause before acting. Hi, I'm Gaurav, and you're watching Gut Instincts. Today's question: do all gallstones need to be treated? Let's break it down. Some gallstones scream for attention, causing biliary colic type pain or complications. We have discussed this in our video on the treatment options for gallstones. Do watch that. These patients need treatment. Surgery is necessary to remove the gallbladder and stones. The risk of future problems will get nipped in the bud. For those unfit or unwilling for surgery, stone dissolving medicines exist. Unfortunately, these medications are only effective against certain types of stones and often prove ineffective. We will discuss more about them in another video on treatment for gallstones without surgery. Now, let's talk about a patient group that often finds itself in a diagnostic limbo. Those with vague, non-specific symptoms that might be due to gallstones or might not be. These symptoms, example, bloating, acidity, which we have detailed in our video on symptoms of gallstones, don't scream classic biliary colic type pain. They whisper, they hint, they confuse. The scan shows gallstones, but that's it. No other abnormalities. So, the question arises, are the stones the culprit or just innocent bystanders caught in the crossfire? Now, here's where things get tricky. A mediocre medical response, and sadly a common one, is to jump straight to gallbladder removal surgery. Stone seen, some symptoms present, remove the gallbladder. It's tempting, it's decisive, but it's also lazy. The better approach: pause, investigate, look for other causes of these vague symptoms. Could it be acid reflux? Could it be IBS? Could it be something the scan missed entirely? If no other explanation emerges, only then consider surgery. But even then, a short period of observation might be wise. Let the symptoms evolve. Let the picture clarify. In the meantime, patient meets the criteria for stone dissolving medications. Those can be initiated. They are not miracle pills, but they might help, especially in borderline cases. Now, if surgery is eventually advised, it must come with a clear-eyed conversation. Because here's the uncomfortable truth. Even after gallbladder removal, the symptoms may persist, and if that happens without prior counseling, the doctor might find themselves the proud recipient of a savage Google review. Yes, in India, doctors are now rated like restaurants and hotels. There's a whole discussion to be had about the flaws in this rating system, and we'll probably get to that in another video. But let's address a deeper misconception that doctors should always be 100% accurate. Every diagnosis, every decision, perfect. If that were truly expected, I suspect many of these perfect doctors would switch careers and become stock or options traders. A much better reward to risk ratio for the amount of stress faced and far fewer midnight emergency calls. This pressure to be flawless, to be fast, to be definitive is driving many brilliant young minds away from medicine. And that's a loss we can't afford. So, to summarize, for patients with vague symptoms and gallstones on scan, we have two paths. 1. Leave the stones alone and search for the real cause. 2. Consider surgery, but only after a thorough counseling and shared decision making. Now, let's shift focus to a group that often finds itself in a very tricky situation. Patients who have no symptoms at all yet discover they have gallstones during a routine ultrasound. These days, this is surprisingly common. You go in for a scan, maybe for a health check, maybe for something unrelated, and boom, you have gallstones. Here comes the anxiety, Googling, and the WhatsApp forwards. But here's the reassuring truth. Most people with asymptomatic gallstones, that's 70 to 80%, will never experience any symptoms, and between 90 to 99% of them won't face any complications either. In other words, these stones are just chilling. No pain, no drama, no need to panic. So what's the medical advice here? Simple. If it ain't bothering you, don't bother it. Surgery is not routinely recommended for asymptomatic gallstones, and those stone dissolving medications, they are often requested. But in most of these patients, they have no role. They are like trying to melt an iceberg with a candle. However, and this is important, there are specific scenarios where surgery might still be advised, even if the patient has no symptoms. Let's walk through them. Surgery may be considered in asymptomatic patients under the following condition, provided they are fit for surgery. First, increased risk of gallbladder cancer. Some people carry a higher risk due to genetics or scan findings. This includes a family history of gallbladder, bile duct, or liver cancer in close blood relatives, large gallstones, especially those larger than 3 centimeters, gallbladder polyps larger than 1 centimeter, particularly if the stones are also present, porcelain gallbladder, a rare condition where the gallbladder wall becomes calcified, resembling porcelain, suspicion of early gallbladder cancer based on scan findings, living in high-risk regions like parts of northern and eastern India, especially the Ganges belt. In gallstone cases in these regions, doctors must use their judgment, balancing risk, patient fitness, and the scan interpretation. Second, surgery for another reason. Sometimes a patient is already scheduled for another abdominal surgery, say a laparoscopic surgery for acid reflux. In such cases, combining gallbladder removal might make sense, provided it doesn't increase the overall surgical risk. Third, hemolytic anemia. As discussed in our video, why do gallstones form? Patients with hemolytic anemia are prone to black pigment gallstones. These stones are more likely to cause trouble, even if they are silent now. So, for these patients, proactive surgery is often advised. 4. Heart transplant recipients. Patients who have undergone heart transplants and are on immunosuppressive therapy, they face a higher risk of severe complications from gallstones. So, surgery may be recommended as a preventive measure. Not all decisions about silent gallstones come from textbooks. Real-world context, patient psychology, and social realities often shape clinical choices, sometimes tipping the scale towards surgery even without symptoms. Let's go through them. In big cities, you can wait and watch for silent gallstones. But in some villages, you don't have that luxury. Either the hospital is too far or is just not equipped to handle a gallstone complication. So yes, sometimes we operate early, not because the risk is high, but because the backup plan isn't. Some patients choose surgery not because of symptoms or the lack of them, but to escape the anxiety of waiting for a disaster. Others are haunted by memories, a relative who suffered badly from gallstones. Even if reassured, they may still worry. And if complications arise later, they might wonder why surgery wasn't offered upfront. One of my mentors, Professor V.K. Kapoor, used to say in this particular scenario, I do not advise surgery, but do not deny if it is requested. It's a philosophy rooted in empathy. Sometimes, doctors suggest surgery not because it's urgently needed, but to avoid future blames, whether legal, emotional, or reputational. But if things go wrong after surgery, they might still be blamed for doing an unnecessary surgery. It's a tough balance between medical science and human judgment. Let's talk about the major risk of gallbladder surgery, specifically bile duct injuries, a serious complication that can dramatically affect a patient's quality of life. Unfortunately, the incidence of these injuries is significantly higher in India compared to developed countries. Why? One likely reason is the widespread performance of laparoscopic gallbladder surgeries, sometimes by individuals who lack adequate training or supervision. However, it is important to understand that there is always a risk of complications with any surgery. even if the surgeon is highly skilled and experienced. And it brings us to a deeper truth about medicine, risk, and decision making. Thomas Sowell, the American economist, said it best: there are no solutions, there are only trade offs. Try to get the best trade off you can get. That's all you can hope for. Perhaps the most important thing about risk is its inescapability. In other words, risk doesn't disappear, it just shifts. If one group is shielded, someone else bears the burden. And in medicine, the burden often falls on the patient, the doctor, or the system itself. This takes us back to where we started: the art of decision making. Not just choosing between options, but understanding the trade offs between each one. William Osler, often called the father of modern medicine, once said, "A good physician treats the disease. A great physician treats the patient who has the disease." This couldn't be more relevant to gallstone management, especially in patients with vague or no symptoms. There is no one size fits all answer. No algorithm that spits out a perfect plan. The treatment must be individualized, based on context, risk, and patient values. During my surgical training, there was a saying that stuck with me: cutting is easy, but knowing when not to cut, that's what separates a surgeon from a mechanic with a license and a very expensive toolkit. It's cheeky, yes, but it's also profound, because restraint, judgment, and humility are what elevate surgery from a technical skill to a healing art. So whether it's a gallstones, surgery, or broader philosophy of care, the message is clear. Medicine isn't about just doing things. It's about knowing why, when, and for whom. Thank you for your patient listening. Whether it's medicine or daily decisions, the most sensible path is usually the best, even if it's not the most popular. If this resonated with you, please share it with your friends. Thank you for watching Gut Instincts. Bye.